I'm a veterinarian at the Wisconsin Equine Clinic, and today I'm going to talk to you about the anatomy of the equine skull. A brief overview of this skull would include 3 incisors on both the upper and the lower arcade, 2 canines, 3 premolars on both the upper and the lower arcades, and 3 molars. Together, the 3 premolars and the 3 molars would include 6 cheek teeth, which they are typically referred to. This particular skull does not have a wolf tooth, which is technically the first premolar and sits within this region prior to extraction. It is very common that a wolf tooth would be removed or extracted within the first 3 years of a horse's life in order to aid in bitting. Horses have teeth that are very different than human teeth. They have what are referred to as hypsodont teeth, which basically means the tooth gradually erupts over time as the tooth wears. Because the horse's tooth grows continuously throughout its life, the structure interiorly is very different. If you notice on the skull, you can see a portion of the tooth here, which is referred to as the crown of the tooth. The root of the tooth is referred to as the reserve crown. In a horse, because the tooth grows constantly throughout its life, the biggest part of the tooth is actually encased within the skull and is comprised of a very long tooth root. For these first 2 teeth, generally, the tooth root is encased in the bone. However, for the teeth in the back of the mouth here, the tooth root is very long and can be in very close approximation to the sinus. This can cause problems in many horses if we have infection within the tooth root. Because it is very close to the sinus, it's very likely you will get a secondary sinus infection with infection in a tooth root. When talking about the front teeth of the horse, or the incisors, the structure of the tooth is similar in that you have a crown, which is visible, and also a reserve crown, which is embedded into the bone. However, because there is no sinus located near the front teeth, there's typically fewer disease processes that can occur if you have problems with the front teeth. So this has been a basic overview of equine dental anatomy. As you can see, the horse's mouth is constantly changing, so because of this, we recommend a yearly oral exam and routine float. If you have any further questions, please contact your veterinarian or feel free to call our office. Again, I'm Nadia Czajkowski with the Wisconsin Equine Clinic.